All right. I'd like to call the Health and Human Services Committee to order. Madam Clerk, roll call, please.
Commissioner Marecki has requested an excuse. Commissioner Baydun.
Here.
Commissioner Anderson. Commissioner Colleen.
Here.
Chair Baker McCormick.
Here,
You have a quorum present.
thank you. Next item.
B, Chairwoman's remarks.
I have none. Next item.
C, approval of the July 2023 meeting minutes.
So moved. I'm supporting.
There's been a motion and support. Nope. Oh, I can see.
I'm answering it there.
All right, and all those in favor?
Aye. Aye.
Any opposed? Motion passed. Nick, oh, sure. For the minutes,
Yeah.
Okay.
I can't attest to the accuracy.
okay. And abstention from Commissioner Anderson for the minutes.
Motion carried.
All right, next item,
D, unfinished business. There is none listed.
next item.
Item 1, under new business. Forwarding the medical examiner's office turnaround time analysis from March 1st, 2023 through May 31st, 2023.
Thank you. Who do we have here from the administration? Medical examiner's office? You can sit right here at the, yep. And your name and title for the record, please.
Come on, there, Sal. Help out with the mic there, Sal.
I'm sorry. I'm Charlie Rose. I'm the division director for the MEO office.
Rhodes.
Okay, got it.
We-
Rose as in flower.
Okay, thank you. All right, so can you just give us a report on this?
Just a brief overview.
Mhm.
So between, so between March 1st and May 31st, we've had 558 autopsies. No, I'm sorry. We've had, let me see, through the 92 day period, we have 4,000 decedents. 800 of those were accepted to our jurisdiction. 558 of them had a full autopsy, 19 inspections only. Scrolling down through that, 453 of those cases were submitted for histology. And our histology categories include cases where tissue blocks are prepared for slides and things like that. And the turnaround time for that has been 2.8 days. Going down to final cause of death and amendments, out of those 828 cases from March 1st through May 31st, let me see, the average turnaround time for the final cause of death has been 16.7 days. As we go down to cremation permits. So I know that was a big thing with the turnaround time for the cremation permits. Yes, so we got that down. It's actually from 0 to 6 days. So on average, a day, within a 8-hour workday, we'll have those finished. A lot of them that have been outstanding is because of non-payment from funeral homes, and it's a delay there. So, you know, sometimes they don't pay on their bill on time, so we hold their cremation permit until theirs are paid, and then we accept them. So, and sometimes it's only about a day or so.
Okay, and what's the fee for?
The fee is $75.
Okay. And so if they have if they've had a bill, a past bill.
Yep.
For any certain amount,
Mhm.
then they have to clear that up.
Yep, they just have to clear it up.
Okay.
Yep,
Okay. Okay, is that,
that's it.
that's it?
Mhm.
Okay. And sure, go right ahead. Mhm.
Just wanted to ask you, what type of payment plan? Do they have something that's, I'm sure they can do it electronically, right? Payment?
No, it's not electronic payment yet. So they usually do it by money order or cashier's check.
So somebody has to physically drive it down?
Yep. So most of the times they either drive it down or they mail it in.
'Cause I'm thinking of the family that doesn't know that this is why it's being delayed. And if there's any other way to get that payment, have they explored whether or not there might be ways to send it, if they go to a bank and have the money wired?
So the payment is due from the funeral home, not the family
Right,
itself.
right.
Yeah.
I understand, but
Mhm.
they're the ones that are suffering for waiting to
Understood.
their families remains, family members remains. So I'm just asking, maybe you can look internally, the department can look internally and see if there's not another way that they could take the funeral home could make that payment electronically or something. I understand then you have issues with if you have someone that's not paying the bill and has a past due balance,
Mhm.
if they could catch that bill up, but if they're in good standing and it's just waiting for the one payment,
Mhm.
that it looks like there would be an electronic way rather than, because the time involved coming downtown, if they're trying to run a funeral home and come downtown and to make the payment park and do all that, just maybe if you could
Understood.
let us know by the next time you come before us, if there's some other way that they're looking at taking payment from those funeral directors.
Absolutely.
Thank you.
And to that point, there's a way that they requested electronically,
Yep. So they
right?
requested through EDRS. Yeah.
Okay, so it seems like through that same system, they could include some type of
I know that
payment.
they've been trying to work
Okay.
something out with that, but I know
Mhm.
it's some issues with like
Glitches.
software and stuff.
Okay.
Mhm.
So when you say trying to work that out.
So
do
I
you
think
mean
it's something
they're-
like with the case manager system. So I don't think it's just like a plug and play, situation like with IT. I think it's like a full process. that they
Okay,
have to go
but
through.
is there some plans that you know of to include that in the, as part of the system where you
Probably in the future,
request
but not
it?
at this time.
Okay.
Yeah.
Well, yeah, we highly recommend that because that just makes sense when you call to order it, you can pay for it online and maybe that will also help, the delinquencies and things of that nature. Yeah.
Understood.
I also had a question about the death certificates and the process of requesting those. Are they in the same system when you order for cremation?
No, so it's two separate systems. For death certificates, that would be through the clerk's office.
Okay.
Yep. So on our end, we're just inputting the information like cause and manner, time of death, things like that. So then it's a separate system when it comes to the clerk's office where the families or the funeral homes purchase the death certificates within itself.
Okay, so when they request a death certificate, well, you report it to the clerk's office.
Yes.
Is that correct?
So it's
And
through EDRS.
okay,
Yep.
through that same
Mhm.
system.
Mhm.
And then the clerk office can then release the death certificate to the
The funeral home
family.
or the family. Yeah.
Okay.
Mhm.
Yeah, because I know it was some issue with death certificates as well, being released or from your records to the
Okay.
clerk
Mhm.
at one time.
Okay, so
But-
it could have been, so sometimes it's them waiting on toxicology results to get the final cause of death.
Okay,
So that could cause a delay sometimes. Yeah.
okay, great. All right, any other questions from Commissioner? Vice Chair, Commissioner Colleen.
Madam Chair, thank you very much.
Mhm.
Yeah, for the cremations, that's gotten considerably better.
Thank you.
Which I guess is why I'm not hearing from the funeral directors in my district anymore.
That's right. Yeah.
You said, and this is just rough numbers.
Mhm.
We had roughly 800 folks go through and about 500 got full autopsies. That seems to be high from where the trends had been going. I know doctors have been complaining a long time and people that are studying illnesses and whatnot, that just not enough autopsies are being done to really track throughout America. Are we doing more autopsies than we used to do?
It seems to be about the same. Quarterly.
Because it just seemed high to me, because I also know that with Wayne State University here, there's been a heightened concern about generating more data for what's going on with anything that might be going on in the community and so it just struck me as high. Is this report published on our website? You're publishing more data on the website. I didn't check for this.
No, the quarterly report hasn't been, the annual report was, but not the quarterly one.
So you're going to do it annually, but not quarterly.
Yes.
Okay. And what's your annual? Is that October to September or
Yes.
January to
It'll be
December?
January to December.
January to December.
Mhm.
So this would be the third quarter
Yes.
report? Okay. All right. Thank you very much. Thank you, Madam Chair.
Thank you. And you brought up, Commissioner Colleen brought up Wayne State. I'd like to have a meeting at some point or bring the new director,
The chief operating officer.
chief,
Okay.
thank you
Mhm.
for correcting me.
No, it's fine.
Chief operating officer, because I don't think we met or had him here at our meeting before.
Okay.
So if that's possible,
Absolutely.
that would be great,
Okay.
just to, yeah. Well,
I know there was a bunch of, if I can say it this way, Wayne State suits that came to our meetings.
right, but I don't think
when
he,
we were negotiating all of
Mhm.
this. I don't
But no,
remember.
I think he just started in March, if I'm not mistaken.
right,
Yeah.
he was out of state at the time,
Mhm.
right? So it would be just good to put a face with the
Absolutely.
name.
Yep.
So if you can let us know, maybe one of the meetings, any of the meetings, he could come
Yep,
and just
absolutely.
introduce himself.
Okay, no
That
problem.
would be great.
Mhm.
Any other questions? All right, thank you.
Uh-huh.
And for this item, we'll take these items together. So next item, please.
Item 2, requesting commission approval of Amendment 1 to a grant agreement with the U.S. Department of Health and Human Services, Office of Minority Health to continue the Wayne County Health Catalyst for COVID Cares Program.
Right, anyone from the administration?
Hi there, this is Avni zooming in. Apologies for not being there in person. Chair Baker McCormick, this is Avni Sheth, Medical Director of the Public Health Division for Wayne County HHVS. This is request for approval to an extension to the grant agreement of Wayne County Health Catalyst Grant, so the COVID Care Grant that we received from the Federal Department of Health and Human Services, Office of Minority Health, in their Advancing Health Literacy to Enhance Equitable Community Responses to COVID-19. You may remember this coming to this body probably sometime last year, including the contracts that were under this grant. The initial grant period ended June 30th, and we had the opportunity to extend it for another additional year to kind of complete the work that was underway with this grant. There's no the amount is the same. It's a time extension.
I see, thank you. Any discussion from commissioners on this item? Question? Oh, go right ahead, Commissioner Colleen.
Thank you, Madam Chair. Yeah, a question for our health officer. Can you share with commissioners what the current recommendations are on COVID vaccines? You know, I know we've gone through a lot of them. Are people still like 6 months annual, depending on the type of vaccine you have gotten? Can you share something with us that we can also share with the larger community out there about what the current recommendations are for getting your COVID vaccine?
can
Dr.
chime into, yeah, I can chime into that. I wasn't
Go
sure
ahead.
if it was directed to me here. Yeah, so the vaccine recommendations continue to evolve. So I think you're absolutely right in kind of understanding them again and making
Mhm.
sure we're communicating, and you all have the tools so you can communicate to your constituents appropriately. So, we've shifted away from this whole counting of vaccinations, right? How many doses? So did I receive 2, 3, 4? And now the messaging is that we have to all, we know this is not going anywhere. We know that we're going to need booster vaccinations throughout time. And so we are really pushing the message of staying up to date. And what staying up to date means right now is that everyone has received their that the bivalent booster that was rolled out last fall for the first time. Okay, so you could have had 4 or 5 doses before, but if you didn't get that new vaccine that was rolled out last fall, you're not considered up to date. And so this is definitely a message that we are stressing and working with partners on how to communicate, because we do see this decreased enthusiasm for vaccination over time, where the folks that came out in the beginning, I think we did a really excellent job at Wayne County to vaccinate our population. We saw those numbers really dramatically reduce as these boosters and these new formulations were rolled out. So that being said, the caveat is that we know that there will be a new recommendation coming out for the fall, right? And so we'll probably be hearing more information on that in the next few weeks. And it'll be actually a new formulation of the vaccine that better is more effective for the variants that are circulating right now. And so that's another thing about COVID. We know that, about at least 2 times a year, we have new variants coming out that have taken over other variants. So we have to kind of really stay up to date with our vaccine formulations. And so there'll be a different recommendation that will be coming out associated with that.
This is Commissioner Clean again. Can you send to commissioners exactly what you just said?
Absolutely.
Along with the caveat that there'll be new recommendations coming out. For myself, I'm coming up on my annual, after I received the bivalent, I think it was early November, and I've just been wondering for myself where I'm at. And also what if you could also pass along to us, I don't believe there's any subsidies anymore for paying for the COVID shots so what people's expectations would be, that it'll come off your insurance or something. If you could share that with us too, both what are the current recommendations, throw in the caveat of, the feds will be issuing new guidelines in the fall, and then how do you pay for it? So if you could share that, some sort of statement like that, I think it'd be very helpful. I want to get it out to folks, and I'm sure the health department does as well. So I'd appreciate that. Thank you, Madam Chair, and thank you.
Absolutely.
Thank you. All right. Any other discussion on this item? Next item, please.
Item 3, requesting commission approval of modification 1 to a grant award with the U.S. Department of Health and Human Services, Health Resources and Services Administration Health Center Program to continue the fiscal year 2023 expanding COVID-19 vaccination program at the county's 2 federally qualified health centers in the city of Hamtramck and Wayne.
Any discussion on this item? Next item, please.
Item 4, requesting commission approval of amendment 4 to a fiscal year 2023 local health department comprehensive grant agreement with the Michigan Department of Health and Human Services to receive and disperse state grant fund to carry out program activities for numerous local health department program services.
Anyone to talk to this item very briefly?
Hi there, Chair Baker McCormick. This is Avni Sheth again from Medical Director for the Public Health Division under HHVS. So this is amendment number 4 to our annual comprehensive agreement with MDHHS. So the CPVC grant that funds many of our public health programs. In this amendment 4, we have increased funding for a few of our programs within this, throughout the year. DHHS increases and decreases funding for various programs depending on what resources they have. And so in this amendment, which is really the final amendment of this fiscal year, it includes increases to our lead hazard grant program that funds lead abatement work in some of our higher risk communities. So we have an increased funding to do a little bit more of that work before we close out this fiscal year. We also have some funding in our TB program and some small amount of funding for our Mpox or monkeypox efforts.
Right, any discussion on this item? Commissioner Killeen?
Thank you, Madam Chair. Just a clarification here. We get the quarterly updates from the state of Michigan. But this is the last one for the fiscal year, but doesn't that reflect the state fiscal year of July to June? Isn't that how it works? It'll be fourth quarter for the state, but third quarter for us.
So our
right?
grantee, I can speak to our term award for the MDHHS agreements. It's from October 1st through September 30th. So it does mirror
Oh,
our
okay.
fiscal year. Yeah. It
It's
does
on the
mirror
same
our
one as
fiscal
us.
year. Mhm.
Okay, I just wanted to make sure, because I thought by the time we get done, there might be another quarter that goes by before our fiscal year is done, but
Mhm.
okay, so it's not, this is grant agreement is October to September.
Correct.
Okay, thank you, Madam Chair. I'm clarified.
Thank you, Commissioner Killeen. Any other discussion on this item? All right, we will move to the next item. Item number 5.
Item 5, forwarding notification of an emergency procurement report for purchase order terms and conditions with Motorola Solutions, Inc. for two-way radios and associated materials for the juvenile detention facility until the criminal justice complex opens.
Right, do we have all right. Your name and title for the record, please.
Good afternoon, Madam Chair. Melissa Fernandez, Director of Juvenile Youth Services. This is regarding our two-way radio purchase for our staff at the detention facility. We purchased them during the emergency as we increased our staffing and increased our footprint. We were in need of additional resources when it comes to our radio and our communication.
Okay, and so currently, do we have two-way radios? Are they not the ones we're using? Are they not working now, or you need more? What?
Both. So we do. We've increased our staffing significantly and we continue to do so. We've increased our footprint. I can't tell you the last time radios were purchased. It was way before, me. And so we definitely are in need of them. And especially as we prepare to move to our new site as well.
Okay, and so these will transfer over, so it's not like we won't use them at
That
the
is
new
correct.
location, so we'll be. And how many are we purchasing again? And was there a reason why we had to go to Illinois for this contract?
I am not sure how many we've purchased. I can certainly answer that. And I believe this is a contract with Motorola that's already being used with the county through the Sheriff's Department and through Michigan State Police. Yes, I see heads
Okay.
nodding.
So this is already a contractor we work with.
Correct.
And so we just chose to continue to work with them.
Correct.
All right, any other questions from Commissioner?
I think, thank you, Madam Chair. I think you asked the question. So this equipment will be transferred to the new facility. We will have a use for it, obviously, over there.
Yes.
Thank you.
And thank you, Commissioner Baydoun. Commissioner Killeen.
Thank you, Madam Chair. This is coming to us as a receive and file item.
It should be, yes, because it's an emergency.
Yeah. I guess somebody needs to give me history of of the declaration of an emergency over there. I thought we had one early in the year and then we didn't. Has there been a second emergency declared there?
No, there has not.
So it's only been the one.
That is correct.
I thought at some point we said, nope, emergency over. We don't have a health emergency there anymore. So help me, please.
Dr. Abdul El Sayed, Director and Health Officer, Department of Health, Human and Veteran Services. We declared our public health emergency in March. We brought a formal end to that emergency in June. This is a receive and file for a contract that was both initiated and completed during the emergency. So we're bringing it to commission per protocol for emergency contracts.
Okay. I guess I would ask Commission Counsel then, because I see that although the communication was delayed, dated June 13th, which probably would have been within the original.
I think technically not during the original.
Because then we didn't receive it until July 6th. So I'm trying to find that window. To me, this was not during the emergency.
So the execution of the contract, right, itself in terms of the initiation of purchasing the product, the two-way radios, that was all done during the emergency. Our communication to commission, I agree, was secondary to that. And the reason we operated with the emergency is entirely around the pressure of time.
Oh, I got that, but I also have a duty in my seat too. And so I guess, and this came up at the last meeting, I guess I would ask Commission Counsel to issue some sort of a ruling or whatever on these emergency.
A statement.
When, if they started the paperwork while there was an emergency, but the emergency was declared over by the time we actually generated paperwork and got it to the commission. I think we need a clear understanding of this. What do you think, Counsel?
Through the chair to this honorable body, if there is an emergency, then the services that we're seeking or the goods that we're seeking during that emergency will be procured during that emergency. Now, the procurement ordinance indicates that paperwork trails, right? So they initiate it, they process it, and I believe we changed it recently to 60 days, if I'm not mistaken. They would allow them 60 days after they initiated to submit it. I don't know how far behind this particular paperwork was, but to your question, the services and the goods should be procured during that emergency period, which I think is what was stated.
Yeah. See, and I didn't see a reference to that in the paperwork I received. And maybe that's something that should be added into the work that we get from our staff to say this was procured during the period, even though you're going to be voting on it after the period is over. I know that would be helpful to me, just to make sure we're doing everything properly.
Absolutely. Staff can note that. I believe the purchase orders we have would indicate those
Okay.
dates, but we can make an effort to note that for commissioners to make it clear.
Yeah, and I wasn't, maybe republish the 60-day thing, so we understand that too. That as long as it was initiated, and and there's like a 60-day time period for the paperwork to get through or something you referenced. I think just restating that, because your 60-day was news to me today.
I can't remember if we changed it to 60 or 90 because it's not currently up or Muni
Yeah.
code, but I believe it was a 60-day because
Yeah.
I had that discussion with the department and Aaron specifically about extending it out to allow time to get the paperwork here.
Okay,
But
yeah,
I'll get that to you.
thank you. Thank you, Madam Chair.
Thank you. Any other discussion on this item? All right, we'll move to the next item.
Moving to the addenda, item 6, requesting commission approval of a comparable source professional services contract with Team Mental Health Services to provide therapeutic services for post-adjudicated use as they await a court order for long-term residential treatment.
Good afternoon, Madam Chair. Melissa Fernandez, Director of Juvenile Youth Services. We're requesting approval for this contract with Team Wellness. And what Team Wellness will be doing is providing on-site mental health services for youth at JDF who are post-adjudicated. As this body has heard many times, we have many youth at JDF who are post-adjudicated and waiting for care and residential treatment. What this will allow us to do is to start providing therapeutic services on site so that they either can be released early with the therapeutic care instead of languishing and waiting for residential care outside of JDF, or transition to the Team Wellness day treatment program that we were instrumental in getting up and running.
Okay, is there any discussion on this item? Commissioner Khalil.
Thank you, Madam Chair. Can you give us an idea of how many people are eligible for residential and then how many beds are actually out there
Sure.
and what the backlog is? How many people are we keeping in the JDF? Simply because, if I can say it this way, the state funded residential facilities are kind of
Disappearing, right? I can tell you today, our census is 153. Today, I have 52 youth who have been waiting for residential treatment outside of JDF long-term care. Of those 52 youth, 18 have been waiting over 100 days, and I have 2 youth who have been waiting over 365 days to be placed in a long-term residential facility. Currently, the state has 150 beds for long-term residential care. At one time, that was 400. That's 150 beds for kids all over the state.
Yeah.
And 52 of them are sitting at JDF. And I do need to add that's without time served.
Yeah, it's not a good situation for those, and
Correct.
it's not a good situation for you either. Does the fact that Detroit Wayne Integrated Health Network is in the process of building out, I forget how many beds, they're going to add 150 or something, I can't remember the number. How is that going to impact us?
Yeah, I believe that's specifically for psychiatric and mental health care. I'm not sure if that specifically targets young people who are committed to probation level 2.
I
right?
got you.
So
There's the difference.
exactly, that's the difference.
There's the difference.
The
right there.
adjudication piece.
Yeah. Do you seek for youth that need mental health beds?
Yes, we need mental health beds, but again, specifically for youth who are needing
Right.
secure mental health. Yes.
And is that a backlog as well?
It is definitely a backlog. That is another reason that we have kids languishing at JDF waiting for mental health beds at either Havenwick, Hawthorne that just
Yeah.
don't exist.
And how many youth fall into that category?
I'd have to check those numbers, but I'd say a large number.
So whatever Detroit Wayne does will be helpful for those kind of beds.
Yes, absolutely.
Okay. Thank you.
Thank you. So of those 52, are those part of the mental health individuals that need mental health treatment or?
Correct. So the Team
Okay.
Wellness Program will target all of those youth who are waiting for those long-term beds.
Okay. All right, any Commissioner Hattis, who has joined us.
The funding for this program 100% by Wayne County.
The 6 months program, the funding will come from the juvenile and youth opioid funding for this program.
Upward, okay. Because we have to look for some increase in.
Can you
fund-
talk into the mic,
Yeah.
please? Thank
we
you.
need to increase the funding for that and the capacity, because it's not something we should have waiting list, because some of them it become emergency situation. And it's something we need to pay attention to. Because there's some people counting on us to help their loved one.
Mhm.
I
Yeah.
don't know how the budget addressing that, but it's time to address that too.
Yes, especially if they're post adjudicated and they're just kind of lingering and I don't get that, but what else can we do? Any suggestions?
We are working closely with the state in trying to come up with solutions for this program. I mean, for this issue, it's a systemic issue and JDF is a symptom of the systemic issue.
Yeah. Commissioner
Yeah,
Cooley?
just a quick comment, Madam Chair, to you and to our staff there too. This puts a burden on everybody because there's not enough beds.
Mhm.
And so it's just a bad situation until more beds become available. So it's not good for us. I
Yeah.
understand what my colleagues are saying, that if you shouldn't be in the JDF, then you shouldn't be in the JDF. But we have people that shouldn't be in the JDF that are there. And then you have a snowball effect that we've been discussing for quite some time at this committee. So just a comment, Madam Chair.
Thank you. Any other discussion on this item? All right, well, is there a motion to receive and file items 1 and 5 and to approve 2, 3, 4, and 6?
I'll make that motion. I'll make the motion that the chair just said. Support.
It's been moved and supported. All those in favor? Oh, we can use our, I guess, can we use it? Yes. Okay, mine isn't doing anything, so
Motion
Okay.
carried.
If you can put me as a abstain on item 6, though.
Noted.
Thank you. All right, next item.
F, such other matters as may be properly submitted before the committee.
Any other items? No, no other items. Next item.
G, public comments.
Any public comments from in the audience? On Zoom? On the phone? Emails?
No emails are received and no hands are up in the chat or on Zoom.
Right, next item.
Adjournment.
So moved.
Meeting adjourned.